If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
And hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. This is our 14th season, and as you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we are here to bring you timely health discussions. For those who are new to the show, there are two ways to get your questions in. First, you can call our live phone line at 718-499-6101. It's a lot of openings right now. Second, I've been getting a lot of these now, emailing us. Email us your questions to askthedoctor@natny.net, and we'll bring them into discussions for today. Now, for this episode, we have Dr. Margarita Kotsina, geriatric medicine attending at the New York Methodist Hospital. We also have Dr. Michael Abbott, internal medicine, pulmonary medicine, and geriatric attending at the New York Methodist Hospital. And Dr. Annette Visconti, emergency medicine attending at the New York Methodist Hospital. Welcome, everybody. And thanks for coming out tonight. It's a little stormy, but everybody's here and looking good, and we're going to have a great show. So let's get right to the news, the big feature of the show. First item is wrist size and heart risk. Now, you would think when you have your kids running around and you grab them by the wrist, you wouldn't think that you'd have the answer to know who might develop diabetes and heart disease. But a study came out of a major journal known as Circulation, which is a well-respected cardiology journal, that showed that wrist size was linked to insulin resistance. And that's where the insulin doesn't work quite right, and it actually is often seen right before somebody's going to get diabetes. And it seems that insulin resistance, this condition, causes the bones to grow bigger. So when you measure someone's risk, and it's not how fat it is, it's just how big it is from the bone, if it's a very high level, there's a good chance that this person may go on to get diabetes and heart disease. Now, it doesn't mean it's going to happen, but it's something that your doctor can use to help prepare the patient. And there are ways to prevent the onset of diabetes in many cases by exercising and so on. And it's showed to be a better correlated than what people had been using, known as BMI, or a body mass index, which talked about how much weight you had and versus how tall you were. So it's very interesting. So ask your pediatrician about that. Now, another finding, another study showed that blindness may be prevented by vitamin D intake. And I don't know you guys, but there's been a big interest in vitamin D, right? Maybe we'll get into that discussion during the show. A lot of people asking about vitamin D and their levels now, which they know what they get, and taking supplements of their women. And it turns out that if you look at women below the age of 79, those who took supplements or had a diet rich in vitamin D and had adequate vitamin D levels had a lower chance of developing macular degeneration. And that's a severe form of eye disease that causes blindness. So it's kind of interesting. Again, what can you do? You want to eat fish, dairy, eggs, leafy vegetables, those things that have vitamin D, as well as take supplements. And that'll also be good for osteoporosis. So again, ask your doctor about vitamin D. Big help for women. Now, braids and baldness. Anybody into braids here? I don't know. Braiding the hair, I'm looking around. I don't see, but some people do like to braid their hair. And they did a study. And they took 326 black women to participate. And what they did was they looked at how many of those women were bald versus how many were, and as a result of using braids or this traction hair, that was pulled. And it turns out that 59% of the women who braided their hair had a severe type of baldness develop, which is a very high number, where they begin to get little pus pockets in the scalp, and it ends up scarring the head, the scalp, and they develop bald areas. So it's something that hairdressers and doctors should make the women aware of this, because this is a very high percent. 59% is a big number, have had some degree of this baldness. So you definitely, if you're braiding the hair and stuff, watch out, because you may end up bald, and you don't want that to happen. So it's a word to the wise. And now finally in the news, the Japanese tragedy has now finally, the Japanese government agrees, yeah, this has been a major event. It's now a 7, which is the highest level possible. They weren't as forthcoming in the amount of radiation that was being released in the early part of the disaster. And they said, well, they didn't want to stir a lot of panic and confusion and so on. I think there was a lot of panic and confusion anyway. But This really helps to put the thing into perspective. Only Chernobyl has a 7 level in the history. So we have only these 2 events to this level. I just thought I'd show you something, because this is how people detect if there's radiation around. You know, if you hear this clicking, there's radiation everywhere around us, and that doesn't mean that it's bad. It's just natural radiation as the environment produces. Now, what you don't want to hear is something like this, because then you get too much radiation. Then you got a lot of radiation, and this is what you would hear if you went into Japanese area where the nuclear power plant was and put this out. So you could have people using equipment just like this, each tick, when it picks up an area of radiation. And by the number of ticks per minute, you can tell how much radiation there is. There are more sophisticated methods, but this is pretty much the principle that's used. Actually, unfortunately, it means that probably at least 50 miles right now around that power plant, at any kind of distance, 50 miles away, has ticking like this, leading to increased cancer, birth defects, and thyroid cancer in children. So it's kind of a very sad event, and this at least recognizing it now, gives the government and the world a chance to make plans and to give preventive treatment and screen people for diseases that will occur. So it's called the Geiger counter. And Monsignor, what do you think of that? I know it's sad. Monsignor, he came out in this rain, which always amazes me. Monsignor, thanks for coming. Appreciate that. And the Geiger counter is going crazy over. We're going to shout out to a loyal listener, Eileen Harvey, 88 years young and a 4-time winner of the quiz. So Eileen, we have a really tough quiz today. I'll be very impressed if you can get this one. It's speculated that in every episode of Seinfeld, well, it's not speculated, there is, in every episode of Seinfeld, there's a reference to this fictional character. Who is it? So anybody out there is a Seinfeld fan? Every single episode, they make a reference to this character. He's a fictional character. We'll give some hints if we're having a hard time. So what we'll do is we're going to take a short break. And when we come back, we're going to go to your questions. Now, the topics today are geriatric medicine, internal medicine, lung disease, and emergency medicine. The number to call is 718-499-6101, and you can also email your questions to askthedoctor@netny.net. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor. And I want to meet our doctors. Let's find out a little bit about them. Dr. Kotsina, how have you been?
Yes, thank you very much. I'm very glad to be back, and thank you for inviting me.
It was always a pleasure to have you, working hard as always. She came in just before seeing patients right up until the show started.
Right.
And anything new since the last time we saw you?
No, not really, nothing new.
No good vacations?
No news, no news.
Okay, good. We'll keep having you back. So we'll, Dr. Abbott, and I love we were talking about Greenpoint.
Yes.
I was thinking, this city, how many interesting neighborhoods there are in our city.
Unbelievable.
Tell us something about Greenpoint.
Mix of cultures that go on in Greenpoint. In Greenpoint, we have a large Polish community. We have an Italian community. We have young urban professionals, artists, artisans, and they mix together in the same community, and it's like 9-grain bread. It goes together well and tastes real good.
And we have your wife visiting us tonight. She's in the control room.
Yes.
You're back. We loved you the last time.
Thank you very much.
We look forward to having a great discussion.
Thank you.
And Dr. Visconti, it's great to have you back. Your grandmother's watching again?
Yes, she is.
Where does she live?
She lives in Greenpoint.
Oh, in Greenpoint. So you know what we could do tonight? When the callers call, I'd like to hear what neighborhood they come from and what they think about that neighborhood that's so special, that's interesting. It could be a restaurant, a movie theater, or a park or something. What do you like about it?
Let's see. The last place I went in Greenpoint, I guess, was probably more toward the Williamsburg side. It's a place called Caracas Arepas.
Whoa.
And they make arepas, and they
I like
had,
that accent. Very good. That's very cool.
They had Bobby Flay there, so they did a whole throwdown there.
Wow.
Like an arepa is sort of an empanada that's made of cornmeal.
Excellent. You know what that is? Excellent. It's very good.
What is it, a Mexican?
It's
family?
this was Venezuelan. Very good something sometimes.
Very good. So we met the participants now. We got a full line of phones here. So let's see who is going to be the first caller of the night. Juanita?
Yes.
How are you,
Hello.
Juanita?
Hello.
How are you? Where are you calling us from?
I'm calling from Brooklyn,
Which part?
Kings Highway.
Ah, Kings Highway. Nice place to walk. You like to walk along Kings Highway?
Well, I don't walk much because
Oh.
I take Accessoride all the time. I'm 81. And
81.
Yeah, and I had 2 knee replacements.
Oh, are you a fan of the show?
Pardon me? Yes.
Oh, okay.
Well, I just heard it about 3 weeks ago. Oh, I heard it longer, but then you took a
They give us a week off. Yeah.
yeah. Then I didn't get it because and the last end of it, I heard what I wanted to hear. I wanted to ask, so I
Okay, Juanita, what's the question?
Yeah, I'm 81. Okay, and you know how when a woman gets to be like 30, 40 or 50, she had hot flashes.
Yes.
And she perspires all the time. A lot. Anyway, I'm 81, and I should be finished with all of those things. But I heard the last show I heard somebody had. You were going to talk about it the next time.
Okay, let's talk about it now.
What is wrong with me? I have to change clothes at least 5, 6 times. Everything. My head gets wet. I sweat, and under my arms,
Juanita?
everywhere, and I have.
So I'm going to ask
change all my
Dr.
clothes.
Kotsina. Juanita, I'm
Yeah.
going to get this answered now. What is wrong with Juanita?
Yes,
Okay,
please.
Juanita, can you hear me?
Yes, I can hear you.
Yes. Okay, so there is, we have to look at a lot of different things. Now, you have any medical problems?
Well, I have diabetes too, but it's not very, It's
Right.
very.
All right. So there is, several conditions that can be associated with the symptoms that you've been describing. One is that it could be due to the disease itself. For instance, your blood sugar may go lower than it should be because of your medications that you take for your diabetes, or some changes in the diet. Sometimes you'll definitely have to ask your doctor to check your thyroid gland. Because
I had two thyroid operations when I was younger.
Right. So apparently you
but-
might have been taking the medication for your thyroid.
I don't take any medication
take
now.
it?
That was about 50 years
Okay.
ago.
So yes, please see your doctor and ask your doctor to check the thyroid test. Secondly, there is a number of conditions that when there is a number of hormones produced in excessive amounts in your body, and your doctor is definitely aware of those conditions. And finally, sometimes the symptoms that you've been describing may be secondary to the medications that you're taking.
So we have a number. Anybody else want to jump in?
First of all, sweating like you're sweating, where you have to change your clothes, is significant. We usually use that if you have to change your clothes, your night clothes, that means it's significant night sweats.
Night and day.
Night and day. Well,
That's a good song. Yes.
Day and night.
Yeah.
The issue is that it's hormones. You could have a low-grade infection. You could have some type of blood problem or lymph node problem that you're going to have to look at with your doctor. But if you are having to sweat as much as you are, it's very important that you see a doctor as soon as possible.
We're going to have to run. We'll give you a little extra time. Have a happy Easter.
Well, could you give me the name of the specialist? What?
We're going to give you a referral. You call us
No.
after the show, and we're going to give you the name. Okay?
Okay.
Take
Yeah.
care, Juanita.
Thank you.
Hello, I hear we have Carol on line 2.
Yes, hi.
Hi, Carol. Where are you calling us from?
Queens, New York.
I think I know Carol from Fox News. Carol? I think she got nervous.
Yes, you do.
Okay. So, do you have any medical issues, or you want to try for the quiz?
Yes, Dr. Gardner. I have one medical question.
Let's hear it.
I get a lot of pain in my calves, especially my right side.
On the calves,
Yes.
the back of your foot. All right, let's.
A lot of what?
In the back of in the calf, back behind the knee.
Correct, but severe.
And is it happening all the time, or just when you're on your feet a lot?
It happens when I'm actually not on my feet, when I'm actually sitting. A severe pain that I have to go down and rub onto it.
See, Dr. Visconti, let's see if she has some thoughts on this.
Well, the first thing is, you said it happens when you're sitting. Is it more like a cramp where you feel like your muscles are tightening up?
Yes, but just that part.
I'm sorry?
Just that part of my foot.
Just the
that
back
one
part
part.
of your, is it both legs or just one?
No, both legs, but especially in my right.
Is it swollen at all or red?
Yes. Uh-huh.
It is swollen?
It's not swollen. It's not. It's just the pain there.
But if we were to press on that area, you would feel it?
Yes. Yes.
Okay.
I have to press on it in order for it sometimes to go away.
Interesting. Dr. Abbott?
Yeah, this is actually quite common. Usually occurs at night, and unfortunately, most of the time, it's caused by medication. So, are you taking any medication?
No.
Well, that's good. And you're just getting cramps. Are you hydrated enough? Are you dehydrated at all?
I don't know. I have been. I drink a lot of water.
If I may ask a question that you may not want to answer on TV, how old are you?
46. I will be 46 in July.
Okay. Well, I think that these cramps also could be due to hormonal conditions as well as electrolyte or the salts in our body, and you may want to see your physician for that.
You know, the other thing I was thinking about, I know you're on your feet a lot. It's possible you get a muscle spasm in the calf, you know, by standing, by the way your tilt is. I mean, it's always a possibility. I don't know. Does it hurt when you're off for the weekend?
No, I don't get it in the weekend. Yeah.
So maybe we got to get
So
Fox
this
to get a
is
little chair for you over there. Dr. Casina, final word?
No, I think this is basically, we covered it all, and it's, I think with your remark about the possibility of the muscle spasm, probably this is what it sounds like. But it definitely, Carol, it's very important that please see your doctor and get a complete blood work, and you may find some answers there.
Okay.
So Carol, anything else?
I would like to answer
wait.
go into the question.
Okay, wait,
please.
I got our judges. Don't give any answers yet. First, we're going to repeat the question. In the Seinfeld series, there's a fictional character that's made reference to in every single episode. What is the name of that character?
Superman?
Is it Superman? Carol, this is your first call to the show? Carol?
Yes.
She got so excited, I think she fell over. Carol,
Yes.
this is the first time you're calling, right?
Yes. It's
You're a
the first time I'm calling into the show.
A grand prize winner the first time. I don't think we've had this before. The audience here is going crazy.
Oh my God! For real?
But you get a beautiful handmade plaque imported from Japan.
Thank you.
With a Geiger counter.
No Geiger counter. You get a beautiful handheld plaque, and you could put this on the wall. Do you have a spot for it in the house?
I can make a spot.
This is many people actually move to find a better place to put it. So
Okay.
you think of this. This is great. I'm really glad, and I hope you're going to call back.
Yes, because my mom would have some medical questions later. I will call for her maybe later or next week, Tuesday.
That's great. So anyway, have a great night. Thanks a lot.
Thank you, Dr. Gardner. And thank you all, the doctors.
Congratulations.
Yeah, congratulations. Take care.
Thank you.
Bye. That was nice. Nice first-time
Very
winner.
nice.
Now we're going to go to Jane, who's waiting patiently on line 3. Hi, Jane.
Hi, how are you?
Okay, that got pretty quickly taken, that quiz, huh? Did you know who it was?
I was going to say Kramer.
Kramer.
Right.
Yeah, no. Not
My
good.
question is, I want to know if, this Thursday I have to start chemo because I told you I had breast cancer.
Oh, yes. How did that go? You had the CAT scan for the nodule in the lung.
Right. They did
The
a
biopsy.
needle biopsy. It was fine. It was nothing there.
Beautiful. Great.
Okay. Now, tomorrow I have to go. I don't know if you ever heard of this. A Mugger test.
Yeah, they're going to see. It's just going to measure how well your heart is working. And certain medications they're going to give you may make the heart work less well. So they don't
How
want
do
you
they do
starting.
that?
You'll be fine.
No, how do they do the mugger test?
Oh, that's a nuclear medicine. It doesn't hurt at all. They put a little needle in the vein, and then they have a big thing that covers your body and takes pictures.
So it sounded like an MRI, right?
Not quite. No, it's the same big things over your head, but I think you should do it fine. It's a little easier to take than an MRI.
Because I'm very claustrophobic. I don't like no MRI.
No problem. And we have open. If you do have a problem, you give me a call, and we can get you in an open system.
And then this is what I wanted to ask you. They said I have to have you're going to mix the cocktail for the chemo. 3 drugs. One with A, a C, and a T.
Yeah.
And then they said the next day you have to go back for an injection.
Yeah. I know they're going to to make the white blood cells a little stronger, possibly. Yeah.
Right, probably.
So,
that's
any
what
of the
they
panel, she was diagnosed with breast cancer. I think you're 65?
61.
61. Oh, sorry about that. And she had some lymph nodes, 17 lymph nodes removed. I think
13
were removed. A number of them were positive. She had a spot in the lung that turned out to be benign.
Right.
So we're looking forward to good endings. Any thoughts?
Well, the good news is that since the biopsy was negative in the lung, there's a very, very good chance for a cure, and you should go into this with a very positive attitude. Everything is going to be okay, and just give it time, and you will do very well.
Because last year I had a left pleural effusion, and I had the thoracentesis test.
Right.
And I still have the pleural effusion.
But they must have tested for that, right?
But nobody knows why it's there.
But did your doctor send the fluid from that effusion for
Yes.
the cytology?
Yes, and I just recently had a lung biopsy. They took out 3 specimens and nothing.
Good.
I mean, that's good. You know, the answer, you have the good news, as Dr. Abbott stated, that it didn't seem to spread to the lungs. So this is an excellent news. So
But
I think...
Why do you think I have the pleural effusion?
You know, this is another question that will remain to be answered.
I mean, the director of pulmonology couldn't figure it out.
Actually, pulmonologists can figure it out at least 30% of the time.
Really? And Dr. Abbott's a pulmonologist.
Right. So very often, pleural effusions, although we biopsy them, we put the fluid through tests, at least 30% of the time they undiagnosed and they go away and nothing happens. But in the face of breast cancer, it's hard to tell. And I think that the most important thing is that you go in, you get your mug, you take your chemotherapy, and God willing, the chemotherapy these days is very, very good for breast cancer.
And then at the chemo, I have to have a month and a half of radiation every day.
This is the treatment. That's everybody's getting that treatment. So there's
Really?
an accelerated type of radiation you may want to ask your doctor about. We do it in much fewer days. So
Really?
you call us back after you're done with the chemo, and we'll
Okay.
go over the radiation. Okay?
Okay, have a nice holiday.
You too, and good luck and everything. Joan, hi. Joan,
Yes,
how are you today?
I'm doing well, thank you.
Where are you calling us from?
Brooklyn,
No, which part?
Bensonhurst.
Benson. So what's special? We're trying to learn about each other's neighborhoods here. What's something special about Bensonhurst?
I just happen to like Bensonhurst, been part of my life.
What do you have a favorite park or a restaurant or?
Oh, my favorite restaurant is Rocco's Galamar.
I don't know that one. Does it?
Oh, you must go there. I go out of my way to get there.
Oh, where is it?
65th Street and Fort Hamilton Parkway.
Wow.
You must go in. He'll give you a glass of wine just as you walk in the door.
What do I say, Joan?
Tell him Joan and Frank sent you.
Okay, I'm writing that down.
Yes, you do.
What's his best dish?
Calamar.
What is the best dish? The question is from Dr. Visconti.
Oh, they have everything, a big variety. But I happen to like their salmon.
Oh, salmon!
They
I was
make
going to ask.
outrageous salads.
Oh.
Very good food.
Delicious. So Saturday night.
Saturday night till 8 o'clock is the last sitting.
I'm going to be there.
Okay, maybe I'll be there too.
Okay, Joan. You recognize me?
Yes, of course I
Okay.
will.
Okay.
Okay.
What can we do? Any questions?
Yes, I do. My husband's had a problem with, like, gurgling in his stomach. And it sounds like sometime that water
Okay, gurgling in his stomach. How old is he?
He's 74.
74. And in good health otherwise?
No.
What does he have?
Well, he had bypass surgery years ago, and 5.5 years ago he had a stem cell transplant.
For?
Lymphoma, Hodgkin's lymphoma. He's doing well. He's actually cured of the cancer.
Excellent. Any diabetes?
Yes, he does.
Okay, so we have a number of conditions. Who wants to take this one?
I can start,
Okay.
and then we'll just take it through the panel. So when does it usually happen? Is it
Anytime.
night, day?
Sometime while he's sleeping, sometime just sitting down watching TV.
And does he hear it, or does he
Yes,
feel
you
it?
can. I can hear it.
You can hear it.
That's why she's calling.
Right.
Yes.
And did you notice that did anything make it worse, make it better? There
No.
are any certain things that make it go away?
No, not really.
Um,
It's not all the time.
Does it depend on what kind of food he eats? Because
No.
sometimes, certain foods produce a lot of gas, and that's why this is what you hear.
Yeah, but sometimes even after he drinks water.
Those kind of sounds usually produced by excessive peristalsis, which is the stomach or intestines contractions. And so sometimes associated with a certain type of food that person eats.
See, maybe
So let's,
Dr.
this is as much as I can tell for now.
he doesn't get this when he goes to Rocco's, does he?
No,
I'm getting that. When I get home, my stomach's going to start
because
gurgling.
you don't want to have it.
Okay.
Does he have pain associated with it,
No,
or is it just
no
the
pain.
gurgling sound?
No pain.
Well, that makes me feel a lot better that it's not painful.
No, it's not painful.
Makes it seem like it is just either gas or just excess motion of the gut.
You know that when you have diabetes, sometimes your intestines aren't well coordinated, and sometimes you can have squeezing of one part of the muscle and the other part of the muscle doesn't squeeze, and this pushes water or stomach through it with a swish. Sometimes older people, when they drink fluids, swallow some air. That will also cause this gurgling as well. So it's usually benign. It's not a problem.
It's great to hear from you, and looking forward to seeing you Saturday,
Yes,
okay?
I'll be there Saturday night.
Take care.
Thank-
Now we're going to, before we go to Teresa, who's waiting patiently on line 1, I have to give us a short appeal. And now, as you know, organizations out there, nonprofit organizations, are feeling the pinch of these tough economic times. Now, this is not a pledge drive, but it's just me talking to you. If you enjoy our programs, such as Ask the Doctor, then please show us you're a sport. Not that you're a sport also, but also your support. Whatever you can contribute is much appreciated, because the main thing is that we know you care and that you support us. Also, if any businesses out there want to sponsor the show or partner with the show, please contact the number on your screen. So I think it's a worthwhile event. You contribute to a station that has a theme to it. It's not just any old show, and we hope that you are moved to do so. So now let's get back to the questions, and we have Teresa on line 1. Hi, Teresa. Teresa?
No, this is Rose.
Rose, how are you?
Good, how you doing?
Okay, were you ever called Teresa?
Excuse me?
You never were called Teresa, were you?
No.
No. Okay, where are you calling us from?
I'm calling from Brooklyn. I live in Brooklyn. I live by the Methodist Hospital.
Oh, you live near Methodist?
Yes.
So what do you find special about that Park Slope area?
I love it. I'm here all my life.
What's your favorite restaurant in Park Slope?
La Villa?
La Villa. Oh, I know that. That's on 5th Avenue.
Yes.
It's a big place, actually, across from Blue Ribbon.
Yes, that's right.
Yeah. What's your favorite? When you go in there, what do you like the best?
I like everything. I love to eat.
Oh, very nice, very nice. So what can we do for you?
Well, I had a stroke about 9 years ago, and it left me with on the left side I had it, and my arm hurts me constantly. I had therapy, I had acupuncture, I had everything, and it didn't help at all. Nothing helped me.
Are you able to walk?
I walk, I do everything.
I just have
the
pain
arm is
on
my biggest pain.
Okay, so let's see what happened. If you walk into the emergency department, what Dr. Visconti is going to say to you about that pain.
Well, the first thing I would ask is, how long exactly is it going on, and what have you done for it up to this point? You said acupuncture. Have you done other things?
Well, I had therapy, physical therapy.
Mm-hmm. And is it your entire arm that's hurting, or some particular part of your arm?
Oh, from my shoulder right down to my hand.
Is it worse with moving it, or is it just there all the time?
It's the whole left side, but my arm is the worst side.
Oh, so your entire left side hurts, but your arm is worse?
The arm is the worst part.
Have you tried any medication for it from your doctor or not yet?
No, he never. I know. I don't like to take pain medicine.
Understandable.
Let's see, Mike, what do you think about acupuncture in general?
Well, acupuncture has been shown to be beneficial for certain pain management issues, which this is. If there's no primary problem, this is a pain management issue, Rose. And I would go and seek the help of a pain management physician. Not only can they help diagnose, but they know the right combination of medications, even if you may not like it, to give you the best result without making you feel high or like you don't have your faculties. It's very important, a pain management physician.
If you're uncomfortable all of the time, it's better to at least take some medication to make you feel at least a little bit better so you can enjoy your life more.
Well, you know, I do what I have to do, but the arm is the worst part. The arm is the worst thing.
Dr. Katsina, any final thoughts before we move on?
I think seeing the pain management doctor is a great idea, even though even if you don't take the medications, they are able to do certain type of injections, something that they call something simple, trigger point injections.
What do they call it?
It's called trigger point injections.
Trigger point.
Yeah.
So what they do is they find the painful spots in the areas, and they inject the numbing medications.
Right.
Sometimes those simple measures are very, very effective, and you'll be able to enjoy life. But this is, having said that, is just you have to make sure that nothing else contributing to your problems. Is just we're dealing with the pain as a consequence of the stroke.
So, Rose, have a great Easter.
Thank you very much, and thank you for helping me.
Thanks for calling us. Take care. We had a busy an eventful first half of the show with the quiz answered very quickly. So what we're going to do, we're going to take a short break, restart here, and when we come back, we're going to go to your questions. Now, the topics are geriatric medicine, internal medicine, lung disease, and emergency medicine. We have Dr. Margarita Kotsina, Dr. Michael Abbott, and Dr. Annette Visconti. Don't go anywhere. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are geriatric medicine, internal medicine, lung disease, and emergency medicine. Now let's get right back to the questions. Okay, now we're going to go to Anthony, who's with us on line 3. Hi, Anthony.
Hi, Doc. How are you?
How you doing? Where are you calling us from?
I'm from Greenpoint, Brooklyn.
Oh, we have a lot of Greenpoint representation.
Yes.
That neighborhood's really something, huh? You got yuppies, and you got the old-time people there.
Oh, yeah.
Are you there a long time?
Most of my life.
So what's the best place? If we got stuck there, a car broke down, where would we go to eat?
Bamonte's.
You know that one, Mike?
Yes.
How do you spell that?
B-A-M-O.
Bamonte's.
Yeah.
The old Italian
old
place.
fare-
They have the
old
red, the tablecloth with checkered. Yeah.
Oh, yeah.
Oh, good. That sounds delicious.
Unbelievable.
So we're gonna go in there. So what can we do for you, Anthony?
Actually, I was just, I have a pinched nerve on my L4, L5,
Okay.
lower back, and I am currently also taking injections of Humira.
Okay.
I'm just wondering, is it dangerous because I'm now also, my doctor put me on Narotins, 300 milligrams 3 times a day. I'm curious if I should continue the injections of the Humira along with the Narotins.
Okay.
Anthony, what is the condition that you take in the Humira for?
Psoriasis.
For psoriasis, are
Yeah.
you having any side effects? You feel any different from?
I get like the occasional sniffles, like you feel your immune system drop a little bit.
I see. And how long you've been taking that medication?
The Humira,
Yes, the Humira.
I switched from Enbrel to Humira. I've been taking about 4 years now.
And is it effective?
Yes.
Okay. So, we can split your question, we can make two different questions. So one is that's good. The neurancin has been proven to be very effective in the management of pain that you have from the pinched nerve.
Right.
And as long as you tolerate it well, and so you definitely safe medication to take.
Okay.
Now, when it comes to the medicine for your psoriasis, it's a very, people are very affected by the psoriasis. And if you do get a lot of rashes, it's definitely, it affects your daily life, and you're not able to enjoy your life.
That's correct.
With the psoriasis. So I think it's, there is no known drug-drug interactions with that Humira and neurancin. And, but you'll have to definitely see how you feel.
Okay.
Any questions, you'll please speak to the doctor who prescribed the Humira for you. And there is certain type of, just ask him if you need to get any blood tests done to follow up. And I think you should do fine.
Anthony, thanks a lot for the question.
Thank you.
Be well. We're going to go now to Larry. Hi, Larry.
Hi, Dr. Garner.
Is this the Larry from Rockland County?
This is the Larry from Rockland County.
This is one of our most loyal listeners. Tremendous.
Thank you.
On the computer, watching. Is that hard to work on the computer, or no problem?
No, I have no difficulty with it. No difficulty
Beautiful.
with it.
So all
particularly waiting for you is a delight.
Oh.
I have a question for Dr. Katsinya.
Yes?
Yes.
You want to know how to pronounce her name?
No. Oh, wow, you're doing it very well.
Yeah, thank you. I have been diagnosed with bradycardia. And I find that sometimes when I'm sitting in front of a computer, it seems to create the problem. So I wanted to find out if it was, number one, if it was positional. And number two, when I get up and I walk around and I do physical things, it doesn't bother me. And, I've been told that perhaps a pacemaker might be of some help. And I'd like to get your view on this.
Okay, great. So this is an excellent question. And there is different types of bradycardia. It could be something as simple as a sinus bradycardia. And this is, I think, you have based on the symptoms that you've been describing. So oftentimes, when somebody is at rest, or even during the sleep, we all tend to have the heart rate to slow down a little bit. When you get up and start walking, everything goes back to normal. Now, I assume you've seen the doctor, right? And you have your
I've seen
EKG
the doctor,
checked.
and he took me off medication. I was taking a metoprolol.
Right. And what happens with your heart rate of metoprolol when you were taking off that medication?
It's still low. I mean, it's still low. I can have a pulse in the morning when I wake up of 52, but my the other numbers are like could be 127 over 65, 68.
Okay, so the pulse is 52 is an acceptable pulse. And usually what we do, we'll make the patient walk and see how far the pulse goes and how the heart rate, what happens with the heart rate. And usually when the person has something as simple as just a sinus bradycardia, and your doctor should be able to tell you that, even based on an EKG, so then you do nothing about it. There is a certain type of slow heart rate, however, when the pacemaker is indicated. And the decision is usually made by your doctor, your internist, and the cardiologist.
So we hope that
sometimes
helps
I just get a little flipping when I feel this sensation. I get a little flipping in my head for a moment. It's for a second or two. I don't know if that's symptomatic of anything, or just a reflection of the bradycardia.
Dr. Abbott.
Well, has your doctor done a Holter monitor on you?
He said that my pulse sometimes pauses from 3 to 4 seconds.
3 to 4 seconds. So he offered you a pacemaker, didn't he?
Yeah, he suggested a pacemaker, and I wasn't too enthusiastic about it.
Well, let me tell you that the reason he suggested it is because once the heart slows down and pauses for a couple of seconds, that becomes a dangerous situation. And it would be important for you, after they do all the stimulation tests, you need to see a special cardiologist, a cardiologist electrician. The cardiologist electrician could test the wires in your heart and could test what type of bradycardia you have and if you need a pacemaker and what kind of pacemaker you need. So I would see one of those.
Okay, I appreciate that.
So we hope you're going to do that.
Okay.
And give us a call back, okay?
I will, Dr. Garner. Thank you very much. I appreciate it.
Thank you. I want to say something about Dr. Abbott, because I went to one of his offices, and you get treated there, not just me, but I watched the way that all the patients were treated with respect. They were treated with dignity, and I would highly recommend. I was over on 18th Avenue, and where?
72nd Street.
Excellent office. Thank you.
Very much.
And now we're going to go to Linda on line 1. Hi, Linda.
Hi, how are you?
Okay, where are you calling us from? You sound long distance.
Oh, well, my phone, I have to get a new phone.
What, do you still have one of those princess phones? What is this?
No, those $10 phones.
Oh, so talking, let me hear it talking, enunciate.
I live in Brooklyn, in Borough Park, Brooklyn.
Borough Park, and that's an interesting neighborhood, right? You got a mix of everything there, right?
Yeah, well, I'm near Bay Ridge.
Oh, so on that side of, where do you like to go to eat when you're in that? Do you ever go into that place? What was it, Rocco's over on 18th Avenue?
Yeah. Oh, God, yes, I love it, but it's changed. It's not like it used to be.
Nothing is. I don't know. Everybody going.
Is it a good change or a bad change?
Well, I haven't been there in a while, but it just doesn't. It's not a bad change. It just doesn't taste the same.
Oh,
The
okay.
calamari used to be good.
That's what Dr. Abbott was looking for. Yeah.
What I called you about, I've been unemployed since September.
Okay.
And I can't afford to see my doctor because I'm on unemployment. I can't afford to see my doctor, and I've been without my blood pressure medicine for 2 months now.
That's not good.
And I'm trying to see where, if you know a number where I could get free medical.
I want to turn that on. I want Dr. Visconti to address that, because as an emergency room physician, she must see people
We run
coming
across
in,
this
right?
quite often, yes.
Could you talk
There's
to
a few different things. First of all, for your medication, if we can find you a doctor who can write you the prescription, there's a few different places to get medication for a very cheap rate. Places like Walgreens and CVS and Target have medications for $5 for a month's supply if your medication is on their list. So that's one way to go about getting the medication itself. In terms of going to a place to see a doctor, though, what you can do is there's a few clinics that you can go to which will have sort of a graduated payment scale depending upon what you're making. And those are places that you can find usually affiliated with hospitals. If you want something that's more directly free or very, very low cost, you're talking about something affiliated with one of the city hospitals. So in Brooklyn, that would be Kings County. In Manhattan, you're talking about Bellevue, Elmhurst, and Queens. Those hospital clinics are at a much, much reduced cost if you wanted to go there.
Well, they told me to go to Coney Island Hospital. But I'm talking about, see, I have to have certain tests done, and they say that you have to pay for them, and I wouldn't be able to afford it. Like, I have a growth in my mouth, I need surgery.
The other people who can help you are social workers who are affiliated with a hospital. If you call Coney Island Hospital and ask for the social work department, they might be able to direct you as to what's the best way for you to get insurance.
I think that's a good advice. So why don't you call ahead to the hospital, ask for the social work department, and they should be able to take care of you. Okay, Linda?
Okay, thank you so
Okay.
much.
Have a happy holiday. It's tough, people don't have.
You know, we're seeing so many patients, many of our patients who have been our patients for years have lost their jobs. They lose their insurance. And it becomes a major problem for patients. Now, I won't let a patient go without medication. I won't let a patient go without medical care, and I ask my patients to come in. If I have to charge them a nominal fee or even nothing at all, depending on the circumstances, I do it. Our job is to take care of you, not to have money as an issue.
Dr. Abbott's number's unlisted, so don't try and look it up. Okay, we're now going to go to Mary. Hi, Mary.
Hi, how are you?
You calling us back?
Yeah, I'm calling you back.
What do you think of that now, the lungs? What was it?
I was wondering if pulmonary fibrosis of the lungs, is that hereditary?
Okay, we have a pulmonologist,
Yes.
lung doctor.
Yes, pulmonary fibrosis, by and large, is not hereditary. There are many different types of pulmonary fibrosis, and usually you need a biopsy to figure out the best way to treat it and what the prognosis is. Do you have pulmonary fibrosis?
No, I don't. My mother.
Your
And
mother-
I had a sister as well that had it. She had 2 lung transplants.
Really? You know,
Yeah.
That's a shame. There are some types there are some that are inherited, but by and large they're not.
Thank you. I'm sorry to hear that, Mary, but I hope you have a happy Easter.
Thank you. You as
Take
well.
care. Let's go now to our email, because we got to get to these emails. I can see, I hear pinging, you've got mail or whatever. So this is from a 50-year-old who's a postmenopausal woman, and she keeps suffering yeast infections. Since she was 21, she's now 50. She gets yeast infections, take medications, it turns into vaginosis. She takes medicine for that, then it turns back to yeast infection. She spends all her time with the gynecologist. Do you have any advice for me? Dr. Katsina, do you have any advice?
So first of all, if you do have recurrent yeast infections, it's absolutely mandatory that you would check your blood and make sure that you don't have diabetes, because sometimes it could be just the presenting sign of diabetes. Now, you mentioned the bacterial vaginosis. Sometimes that condition, you don't even need you may not even need the antibiotics for that. I think the best way, you have to, speak to your gynecologist. If you feel that you're not able to get a straight answer or direct answer from your gynecologist, just seek for the second opinion and maybe the third opinion, because apparently you do suffer, and you'll have to have your questions answered.
Thank you for the call. Okay, we're now going to go into the rapid fire segment where we have to answer within 30 seconds. So who is it? We got Joan first. Hi, Joan.
Yes. Hi, Dr. Gardner.
Where are you calling us from?
From Staten Island, New York.
Any particular part?
Graniteville.
Graniteville. Okay, your time's up. Next. No, what can we do for you?
Well, recently my doctor changed my high blood pressure medication. I was on 3 pills, lisinopril, Procardia, and hydrochloride. She told me to stop taking the Procardia and to double up on the lisinopril and the hydrochloride. The reason I'm asking this question is because I have urinary frequency, and I get up twice a night to go to the bathroom, and I was afraid to double the hydrochloride, the lisinopril and the hydrochloride, because they go together, because I thought it would increase my urinary frequency.
So, Joan, what's the question?
Well, I was wondering, I stopped the Procardia, but I wanted to know, is it safe to take the double of the lisinopril and the hydrochloride in spite of having urinary frequency?
I see. What dose of lisinopril are you taking right now?
Excuse me?
What dose, what is the number on the lisinopril pill that you're taking?
What I'm taking now is 10 milligrams, and the hydrochloride is 12.5.
I see.
And she wanted me to take 20 milligrams and 25 of hydrochloride.
Right. I mean, this is acceptable doses of the medication. But sometimes the water pill may make you go to the bathroom more frequently. If it is uncomfortable for you, please contact your doctor, and the doctor, I'm sure, will be able to change your medication to something different.
Yes?
Yeah, but I was stable.
Wait. I want to ask Doctor, I've got to get these two out.
Just one thing. If you're having urinary frequency, there's a reason for the urinary frequency. And you should address that, because that is a very important quality of life issue and may cause a problem with your bladder.
I have a prolapsed uterus.
Well, if you have a prolapsed uterus, there are many things that can be done. You can get a pessary or even surgery to fix that. But as you see firsthand, one thing can cause trouble for the other things.
Joan, so we have to move on. I'm sorry, but call us back and have a great holiday.
Thank you, Doctor.
Take care. We'll go to Maria. Hi, Maria.
Good evening. How are you?
Good. You sound excited.
Well, last time I got the prize, but I didn't get to ask the question.
Oh, I know. We got so sidetracked with that. So what's the question today?
My foot is tingly, and sometimes it feels very cold from my ankle to the rest of my foot.
Okay. So it's a quick question, Dr. Visconti. You got 30 seconds.
How old are you?
Oh, not an air. A woman never tells her
Are you
age.
under 40?
A little over.
Okay, a little over 40. 42? No, it's okay. Go on.
Any diabetes or other medical problems?
No, perfectly healthy.
And this just started out of the blue?
No, it was, I had an accident and, like for about a year and a half. I was told it might be nerve damage.
What was that, Levy and Levy? No, okay. So what was
What
it?
type of accident?
What type of is it?
Did you break something?
Pardon me?
Did you break something?
No.
Okay, so is it possible that we could be having cold feelings in the foot from the accident several years ago?
It's usually more common if you actually had a broken bone or something like that. It depends on what type of accident you had.
So
Well,
what we need to
do. The broken bone was in my upper body. So does that affect the foot part?
No, it should not.
We have to come back to this next. Please call us back in 2 weeks. We're going to come back to this, okay?
Will do.
Okay. Have a great Easter. Take care. Okay, we're going to go to Margaret now on line 1. Hi, Margaret.
Hi.
Where are you calling us from?
Greenpoint, Brooklyn.
Greenpoint. That takes the cake today,
Popular
Greenpoint.
today.
But just because we're in the rapid fire segment, I need to get the question fast. So what is it?
I have to get my tooth pulled, and I'm diabetic, and I also had a heart attack.
I have good news for you. Next time, in 2 times, we're having a dentist.
Well, the thing is, I just wanted to know, they told me I didn't have to take an antibiotic, but is it okay if I want to take one anyway?
And as you know, antibiotics have side effects. Antibiotics can cause other infections. So if you don't have to take antibiotics, don't take antibiotics. Very important.
Very good. And have a great Easter, and we'll talk to you when we get back, okay? Thank you. Hi, Evan. Yvonne or Evan, is that?
Yes. Good night, doctor.
Good night. Good night. How are you?
Fine, thank you. My name is Yvonne Green.
Very nice. Where are you calling us from?
I'm calling you from Clarendon and New York Avenue.
Oh, very nice. Is there a cemetery near there?
No, I'm not so far. I'm just at Clarendon and New York Avenue.
Yeah. It's a nice. I used to see roosters when I drive my daughters to school in Canarsie, and we'd see roosters in the morning.
Okay, that's nice.
Are they gone, the roosters?
Yes, they're not here anymore.
All right. What can we do for you?
Doctor, I wanted to ask you something. I've had 3 accidents. I worked at Mount Sinai. I've had 3 accidents. I'm not working. I'm on 9 pills.
Okay.
9 pills.
Wow, that's a lot.
Yes, I'm hypertension, diabetic.
But so I got to move you along, Yvonne, because we're going to
What I want to know, doctor, I would like to see a very good doctor because I have a good doctor, but he's not taking care of me anymore. And I've had an endocrinologist. I owed him $50, and he's good. But his secretary doesn't want me to pay the money little by little to see him. I am tired. I have an itching in my rectum, and I told my doctor, I think I have parasites. He wouldn't look after me. I am fed up. I am tired. I don't know what to do.
No, I hear it in your voice. You're upset. If you call us, we're going to give you a good referral.
I've been trying to get you since last year, Doc.
You call after the show, and we're going to get you a referral.
And I think I know the lung doctor because he's with Dr. Miliano. And he's a very nice doctor, but it's just for the lungs.
No, he wants his $50 back.
He's
All right.
smiling right there. I think I went to see Dr. Miliano.
Okay, so I want to wish you a happy Easter, and we'll talk to you in 2 weeks.
Are you Jewish?
Yes.
Happy Passover.
Thank you.
I'm interested in the Jewish religion, all religions. I'm a minister.
Oh, beautiful. We got to move on. I'm sorry. Have a great time. Sylvia.
Yes.
Hi, how are you? I'm sorry, you're the last caller of the night.
Yeah, I'm okay.
What can we do for you?
Yes, doctor, I have a dark spot under my eye, come right up to my jaw. What can you tell me about that?
I am not clear about the question. What was the question?
The question is you have a dark spot.
Very dark, darker than my skin.
Dark skin under the eye?
Yes, and goes to the jaw,
Goes to the jaw. So she's got a is it recent or it's been there a long time?
No, it's just recent.
2-second answer, I'm sorry.
You'll have to please see your doctor because it's very hard to decide to give you an advice because you need to see how that dark area looks like. what it looks like. And based
Wow,
on the way it is,
I'm so sorry, but we got
then
to
we'll have to decide what's the best for you.
Anyway, that's it for this episode. I don't know where the time flew by, but I want to thank Dr. Margarita Kutsina, Dr. Michael Abbott, Dr. Annette Visconti for coming in. And we hope we were able to help you. It's good to remember you should always be proactive about your health. Speak to your doctors about your concerns. Just like we told you tonight, go for second or third opinions. In the meantime, visit our website at netny.net/askthedoctor. Here you can see my video blogs, the tablet column, podcasts, the forum, and many more. I want to thank Dr. Linda Lapatosa, our quizmaster, and I want to thank you for all your questions. Now here's a programming note. Because of NET's Holy Week coverage, we won't see you next week, but we will be back in 2 weeks when we're going to talk about pediatrics, neurology, epilepsy, adult sleep medicine, lung disease, internal medicine, cardiology, you name it, we got it. We're going to expand the studio here. So I want to say goodbye to all, wish you all a merry holiday, whether it's Easter, Passover, goodbye, and I'll see you in the tablet.